Hello students, so today we'll begin with another important topic from the evaluation and management section, and that is critical care, a very important topic with many codes and the guidelines. So let's begin. So in this presentation we are going to find out what is critical care, the overview of the critical care codes, outpatient critical care, inpatient critical care and critical care transport service. So let us understand what is critical care. Patient is critically ill or injured, single or multiple vital organ system failure, or the high probability of imminent or life-threatening deterioration in the patient's condition. Vital organ system failure may include the central nervous system failure, circulatory failure, shock, renal, hepatic, metabolic, or respiratory failure. Critical care typically, but not always, require interpretation of the multiple physiological parameters or application of the and or application of advanced technology. Now let us understand the critical care codes. So first of all, these codes are all include the high complexity medical decision making. So there is no MDM is written because all the codes require the high complexity medical decision making. Then the codes are determined by the location of the service. Where the critical care is given, that is also important. Whether did we give it in an inpatient setting, outpatient setting, or the patient in the transport. Then say the third important point is whether the service are face to face with patient or non face to face, that is a transport service. And then the last important point is age of the patient, whether you are giving the service to the neonate, pediatric patients and older patient. So these are all important pointers that will help you to zero down your code. Now, if you see, the codes are in three different areas of the CPT book. One is a critical care service code, which are 99291, and then there is add-on code 99292. Then we have a pediatric critical care transport codes, which begins from 9946647 and 99485 and 486. And then we have a inpatient, neonate and pediatric critical care. In that, the neonate codes are 468 and 469, while the pediatric critical care, they are the code 99471, 472, 475 and 476. And then we have other emergency services code, which are 99288. I would request that you will go to all the codes in your book and just see all the codes properly. Now, the place of service is important consideration when we are coding for the critical care services. So, we have the two different criteria. One is the outpatient setting and one is the inpatient. Inpatient is basically the hospital and outpatient setting is office and emergency department. So as far as the outpatient setting is concerned, we use the code 99291 to 292 and we can use this code for any age. Remember that neonates and pediatric patients from birth up to 71 months of age, that is up to 5 years and 11 months, can be reported using 99291 and 292 when critical care is provided in the outpatient setting. So these codes can be used for everybody if the critical care is given in the outpatient setting. Now we move to the inpatient critical care. Now in the inpatient critical care we have two types. One is 29 days through 71 months, 71 months, that is basically 29 days till 5 years 11 months, and this is neonates 28 day of the age or the younger. So this particular critical care is also called as a NICU, neonatal intensive care unit, and this is called as a pediatric critical care. And we have roughly 4 codes here, and we have 2 codes here. So this is a broad classification of the critical care service, and kindly go through this diagram so that you will have a better understanding of all the codes. So let us begin with outpatient critical care services. The codes are 99291 and 99292. Now let us see. These codes are selected using time. The MDM is always high, and use this code for the outpatient critical care and for the services any age in the office or other outpatient setting such as physician office, hospital clinic or emergency room. So basically, when you see the word, the patient is not admitted or outpatient, or they have used the word physician office or emergency room, we can code it as an outpatient critical care. Codes may be reported over multiple days if the patient condition continues to be critical, even if there are no changes in the treatment being given. These services are provided face to face with the patient. So I highlighted the important word. Kindly just go through them again. Now let us see the code 99291 and 292 in detail. Now these codes are reported for the service in many different settings. So outpatient care any age, we have seen 99291 and 99292. We've been using it. But we can use this code in the inpatient care setting over 5 years old age, and in the transport of services over 24 months, that means 2 years of age. So we can use this code in the inpatient setting also, provided the criteria is fulfilled. Now let us understand some more thing about the 99291. So 99291, this is the code which we can give once per day for first 30 to 74 minutes, because all these codes are time bound. And report 99292, which is the add-on code for each additional 30 minutes. This code may be reported in multiple units when appropriate. Now the time, as far as the time is concerned, it may or may not be continuous. This is very, very important. It might be continuous, it may not be. So how do I calculate the time? So let us assume the patient came into emergency department and his condition was very critical. The doctor gave him critical care for 1 hour, and then the patient stabilized and the doctor went out to take half an hour coffee break, and he came back again, and then again he started giving the critical care. So what happened? And that critical care he gave for 2 hours. So when I calculate the time for this patient, I calculate 1 hour, the half an hour the doctor went out and again came back and again gave 2 hours. So I will calculate 3 hours, not 3.5 hours, because that half an hour the doctor wasn't with the patient and neither he was doing anything to do with the patient. He went out to take the coffee break, so we cannot take that time. So that is very important. The time wasn't continuous, but what I did is I calculated the total time, and must be recorded in the patient's medical record, and must be spent providing direct care. And that's why the coffee, the coffee time is not a direct care. Okay, or the doctor went out to see another patient is also not a direct care for this patient. So all those things we have to keep it in mind. So this is the table which is there in your book, and this is the table for the critical care time. Total duration of critical care and the codes we write. So if the critical care is given less than 30 minutes, then we write appropriate ENM code. That means wherever the service is given, we write that code. If the service is 30 to 74 minutes, then we write the code 99291. Then if the service is between 75 to 104 minutes, then we will write 99291 and 99292. You can multiply it by 1, or you can just leave it by writing 99291 and 99292. So this is how we calculate. Now let us take example for your better understanding. Critical care time of 35 minutes. So the criteria is less than 30 minutes we don't count. But what is our time? 35 minutes. So I'm going to, it comes here in between 30 to 74. That means 35 is somewhere. It's here. So I'm going to write 99291. Then let us take second example, critical care time of 115 minutes. So 115 minutes is here. So 99291 into 1 and 99292 into 2. And critical care time of less than 30 minutes can't report critical care codes here. Okay. So this is a very good table which you will use it whenever the time is given in your scenario. Now let us understand this. Now, I have written a word bundled here. What do you mean by bundle? There are certain services which I have given it here. These are the services are the part of the critical care. So, if the doctor gives the critical care to the patient, he will carry out either 2 or 3 services or maybe more than that. It doesn't matter. But if he carries out any of these services, and the codes are also very properly mentioned, so if the doctor carries out any of these services, we cannot write them by writing a separate code. We will just write the critical care code. Okay, because these are the part of the critical care services and we don't code them separately, and that is mean by bundled. That means they are the these services are included in this code. Now let us move to another service, and that is called as a neonatal critical care. Okay, this is called as a neonatal critical care. Now let us see what are the codes. Now, first of all, we must know the neonatal means 28 days of the age or younger, means neonatal. So, the neonatal critical care codes, they are divided into two. One is the initial inpatient neonatal critical care and the subsequent inpatient neonatal critical care. So, the first day of service is this and any additional day will be this. But the age is important criteria. This is the 28 days or younger. That means NICU. We are talking about NICU. The second is a pediatric critical care. So let us see what are the codes. Now the pediatric critical care, here also we have two codes. Initial inpatient pediatric critical care and subsequent inpatient pediatric critical care. And we have four codes. So 99471, it is for 29 days through 24 months. That means till 2 years. This is the initial and this is the subsequent, that is 29 days through 24 months of age. Okay, so we have 471 and 472. I have used the same color coding so that you will understand that this is the initial and this is the subsequent. And then we have 99475, that is 2 to 5, because this code takes the care of 29 days to 2 years. This code takes care of 2 to 5 years, but initial service, and subsequent will be 99476. So take a minute just to observe this particular diagram. So let us have a quick recap again, that the inpatient critical care service code, the 468 and 469 is for the patient 28 days or younger, and in that the first code is for the initial and the second code is for the subsequent. 471 and 472, the age criteria is 29 days through 24 months, that means 2 years. And 475 and 476 for the patient 2 through 5 years of age, and the first code is always initial and the second code is for the subsequent visit respectively. And 99291 and 292 for the patient older than 5 years of age. This is very important, and that's why wherever there is a chance of confusion, I have put up the yellow color code so that you will always remember. Now, the inpatient critical care services usually provided in the critical areas such as coronary care unit, intensive care unit, pediatric intensive care unit, respiratory care unit, or emergency care facility. These services are provided either face to face with the patient or non face to face. Time on units or floor. Codes are selected using the age of the patient and the time. MDM is always high. So always remember that we use the two criteria. One is the age of the patient and the time. Time means whether you have visited the patient first or the second day. That is time, because unlike your 99291 and 292, they are not minute bound. Now let us underline the important thing. Time may not be continuous. Time must be recorded in the patient medical record. Time must be spent providing direct care to an individual patient either at the bedside or on the unit floor. Includes minutes spent at a patient bedside or floor or unit. Time may be spent reviewing the test result or imaging studies, discussing the patient care with other medical staff. This time is what we call it as a floor time. Means may not be direct with the patient, but it is related with that patient. Now, if you see the codes 99291 and 292, they were reported by the specific minutes spent with the patient per day. That is, we had the table that 99291 once per day for first 30 to 40, 74 minutes, and 292, which is an add-on code which was covering each additional 30 minutes. The code 99468 to 476 are reported for a service per day according to the age of the patient. So there is no minute calculation here, but we code it per day according to the age of the patient. No specific times are included. So this is a very important. Now these code are for the critical patient transport code. They are 99466 to 99486. Critical care patient is being transported from one facility to another. In this case, the code varies when the provider and the patient together in the vehicle, then you use this code. When the provider at the site with the patient in the vehicle, you use this code. So this is mainly for the critical care transport code, and these are also very important. Now, like the outpatient critical care code, the inpatient critical care code also have certain services which are bundled in. And if you see, most of the services are same except the last four. This is the suprapubic bladder aspiration, bladder catheterization. So if you see this particular four, you will see that they are not a part of the outpatient critical care services, but they are the part of the inpatient critical care services. That's the only difference, but most of the codes are somewhat similar to that of the outpatient. These are the bundle code. That means the services are included in this codes. Now, whenever the multiple services are given, like on the same day, like the patient received the critical care both in the outpatient and the inpatient care by the same physician, then we will use the inpatient critical care code for all the services on that day. We won't use it outpatient and inpatient, we will use only the inpatient critical care code. The patient's emergency department care completed and the patient condition worsen and then require a critical care, use both the emergency department and the critical care codes. This guideline we have seen in the emergency department. Patient received both the critical care services and the hospital care or the intensive care services from one physician or the group. For that also we will use only the inpatient critical care code. So when both the outpatient and inpatient happens, we only code the inpatient for that date. That's very important. So while finding the critical care code, What are the criteria we use? First is, where is the patient? Second is, how old is the patient? Third is, was this encounter face to face? And fourth is time factor. And we will consider all these four things to zero down our code. Now let us take our first example. A 40-year-old woman presented to the emergency department with a chief complaint of severe chest pain and shortness of breath. The patient reported that the pain was constant, located in the center of her chest, and had not improved with a rest or over-the-counter pain medication. Her vital signs showed hypertension, tachycardia, tachypnea, and hypoxemia. Further evaluation include an electrocardiogram, cardiac enzyme and chest X-ray was performed, and the working diagnosis was acute myocardial infarction. The patient was started on oxygen therapy for 1 hour and a pain management. The 60 minutes were spent working up this critically ill patient in the emergency department. Of the following, which answer best describe the encounter? Now, where did this critical care happen? It happened in the emergency department. And we have the rule that if the critical care is more than 30 minutes in the emergency department, we will code only for the critical care. So that will exclude our answer A and D, because A and D, they are writing both the critical care code as well as the ED code, but that we do not write. We will write only one code, and that's we have learned it in emergency department. So automatically it will exclude all the wrong answer, and then we will see what is our answer. So we have already eliminated answer A, C and D, and now we will check our answer B, which is correct or no. And here, first of all, what is the time of the treatment? It is 60 minutes. And if you remember the time 99291, we give it for 30 minutes to 74 minutes. So we will require only 1 unit of 99291. Now, what is this code 71047? It is the code for the chest X-ray, and it requires 3 views. If you go and see the bundled services, in that one and 2 views are included, but the 3 views of the chest X-ray is not included. So you have to be that particular. So kindly see that also. And 94644, it is the oxygen therapy that has been given to the patient, that is also not a part of this bundled code, and that's why we will have to write that additionally by writing the modifier 59, and that's why answer B is the correct answer. Let us take our second question. Neonatologist admitted 20-day-old infant to NICU for cyanosis and rapid breathing. He performed intubation, ventilation management and complete echocardiogram in the NICU and provided a report for the echocardiography which did indicate congenital heart disease. Select the correct code for the physician service. Remember, whenever we are coding for the critical care codes, we always ask for the four things. Where did the service happen? Admitted means it's an inpatient. What is the age of the patient? That is another consideration that we do it. And by using this, and how long, the time is not given, but let us see what is the answer. Now we have this code 99291. It is the code for the outpatient all ages. Our case is a inpatient. So we'll be concentrating on A and B. 99460, it is for the ambulance or the transport service. So in between A and B, we have to see the codes. Now, in between A and B, when we see the code, what is the age of the patient? 20 day. That means it is a neonatal. That means it is a in ICU. And for that, we know what is the code. So we will now zero down our answer. So our answer is 99468 because the age of the patient and admission. So it becomes an inpatient in ICU. And the 93303, this is the code that we will have to write because there was a uh, uh, complete echocardiography which did indicate the congenital heart disease, and for that transthoracic echocardiography for the congenital cardiac anomalies is completed. And if you see the bundled services in that, 93303 is not there, so I can code it separately. Now let us take one more question. Infant is born in 6 weeks premature in rural Arizona, and the pediatrician in attendance intubated the child and administered surfactant in ET tube while waiting in the ER for the air ambulance. During the 45 minutes wait, he continued to bag the critically ill patient on 100% oxygen while monitoring VS, ECG, pulse oximetry and temperature. The infant is in warming unit and an umbilical vein line was placed for fluid and in case of emergent need for the medication. How is the scenario is coded? So let us collect our data that the baby was born 6 weeks premature, and the doctor was giving everything in the ER or ED for the all this treatment was happening in the ER. And how long it happened? It is 45 minutes wait. Until that time he was giving the service. Now what all the services are given, that is very very important, because depending upon that we will write the code. Whether do we have to write the non-bundle services and what are the non-bundle services. And in order to find out, let us find out the services given. So he was given the oxygen and VS, ECG, pulse oximetry, and the temperature was taken, and he was put in the warming unit. The umbilical vein line was placed for the fluid. So we have enough data. So let us see what is the answer. Now, since the service was given in the ER and not in the he was not admitted, we cannot use the code 471 because this is for the inpatient. 99423 is not the code, and 464 and 465 is the code for the air ambulance. That is, this service is given prior to that because they were waiting for the air ambulance. So C and D goes away, and now we have A and B. So we will require a code 99291, that is there, but we need to find out whether these additional services which are given, are they bundled into 99291 or no. Okay, remember that. So we will have to just check the services. Now we will go and see the bundled services. Okay. So 31500, 36510 and 94610, none of these codes are there in this particular series. So we will have to code it separately. And remember, whenever you are coding for the bundled services, pay attention because these are the bundled services for the outpatient, and for the inpatient they are different. And here the service what we are coding is for the ER, and that is outpatient, because ER service given is considered the outpatient, and that's why this answer B is the correct answer. So let us take the next question. Dr. Leon was called to the critical care unit, burn unit, to see 50-year-old patient who suffered third-degree burn to 30% of her body. Dr. Leon spent 2 hours 40 minutes with the patient, her family, and coordinating care with the other specialists. He made several phone calls from the unit on her behalf and consulted with the nursing staff. During this time, Dr. Leon provided a ventilation management and a gastric intubation. What codes correctly capture Dr. Leon's service? So first of all, what is this? This is the inpatient a critical care, because the critical care burn unit, okay, and these units are there only in the inpatient. And so we have the important clue. Now let us zero down our code. How long the service was given? 2 hours and 40 minutes. Now 50 years, the age might not be the consideration in this case. Now let us see the first code, 43752. If you see the inpatient critical care, and if you see in that, you will see that there is a code 43752. So when it is a bundle, we do not code it separately. So option A is not the correct answer. Now we left with a B, C and D. Now if you see the answer D, what they have written is 99292 and 99292. So this is the add-on code which we never write in the first place. So without even looking at the other options, I am going to delete option D, because that's not the way we write the code. So now we are left with B and C. Now let us see what our answer. So correct 99291 and 99292 into 3 is what is required, because the doctor spent 2 hours 40 minutes. There was a direct and indirect service. Direct was he gave the ventilation management and the gastric intubation, and the indirect was not with the face to face with the patient, but he was making calls on the behalf of the patient, and trying to get the consultation. And if you see this particular table, you will see that we will require 3 units of 99292, but not the 2 units. So answer C is also not the correct answer, and B is our final answer. So let us take the next example. Andrea, a 52-year-old patient, had a hysterectomy on Monday morning. That afternoon, after returning to her hospital room, she suffered a cardiac arrest. The cardiologist responded to the call and delivered 1 hour 35 minutes of critical care. During this time, the cardiologist ordered single view chest X-ray and provided the ventilation management. How should you report the cardiologist service? This is pretty straightforward. We have a data, the age of the patient. Always take the age of the patient into consideration. We might not require that, but always read that. Then hospital room, that is inpatient. Cardiac critical care is given how long? 1 hour 35 minutes. And in that they have carried out certain services, single view chest X-ray and ventilation management. Always whenever the services are given, you must find out whether those services are bundled or not bundled. So we have enough data. Let us do our drill. So we have collected the data that this happened in the hospital room, and then it happened for 1 hour 35 minutes. So we will, we will take the code. Age of the patient is 52. So in the inpatient, we will use this code for above 5 years of age, and 99291 and 292, 1 hour 35 minutes. So it happens. 1 hour 35 minutes means it happens here, and we will require 99291 and 292. And the doctor took out the single view chest X-ray, and that is also covered here, and even the ventilation management, that is also covered here. Remember, whenever you are looking for the bundled services, these are for the inpatient, and we have a separate codes for the outpatient. So kindly be very particular in reading those bundled services for the inpatient and outpatient, because in a hurry you might end up looking for the inpatient bundled services for the outpatient. Now this is a case report, very important. A 5-year-old boy was brought to the ER by the social worker, who discovered him alone in spasm and seizure. The social worker relayed that the child's older sister told her the boy was bitten on the hand by a raccoon he played with 11 days ago. No treatment was sought for the injury at time, but the area was inflamed and hot. According to the social worker, the mother is a drug addict and often leaves the children unattended. Illness actually began 2 days ago with a headache and restlessness and inflammation at the wound site. The child expired due to the cardiopulmonary failure before any effective treatment could be administered. CPR was performed but was not successful. The physician diagnosis was listed as a rhabdovirus from an infected raccoon bite, not treated due to the child neglect. Critical care was provided for 60 minutes. Which of the following code sets will be provided? Now here we have the ICD code also as well as the CPT code. So we have to be extremely particular in choosing. Now here what happened is the sadly the child passed away because of the maybe the infection or the septicemia, but prior to that he was given the 60 minutes of critical care, and that was given in the ER. And what is the age of the child? The age of the child is 5-year old. So we will have to take the code which are 99291 and 292, because these are the code that we will use it for the critical care which is given in the outpatient, because it is a ER. So we have enough data with us, and now we will zero down the code. So if you see the options, C and D is the wrong option because it does not have the critical care code. B is not the correct option because the critical care that is given for that patient is the 60 minute. And if we remember the time, and you will see that 30 to 74 minutes require only 1 unit of critical 99291, and that's why 292 and 291 is not the correct code, and we will write 99291. And 92950 is for the cardiopulmonary resuscitation. It is not a bundle service. It's for the cardiac arrest, because if you see all this code in that, there is no mention of the code 92950, and so we will have to code that additionally. Question: a physician was called to the floor to evaluate 94-year-old patient. So he was called to the floor who experienced sudden weakness, hypotension, and diaphoresis. Upon evaluation, the physician found the patient in the mild distress and dysponic uh, dyspnoic. The patient blood pressure was 101 upon 60, pulse was 85, and a systolic murmur was noted on the cardiac exam. EKG revealed ST elevation in the leads. V2 and V6 lab results were still pending at the time. The patient was admitted to the CCU with the diagnosis of acute anterolateral myocardial infarction and hypotension. The physician provided total 48 minutes of critical care time, which is the most appropriate CPT code. So let's have our data collection. It happened on the floor, 94-year-old patient, and the doctor gave the total time of 48 minutes of critical care. And now we have all these things. 99236 is basically the admission and discharge on the same day. 99233 is the subsequent day. 99253 is the consultation code, and here the doctor went to see the patient and he gave the critical care. So we will have the critical care code, and we know the time. We will put the time and zero down our. So yes, 99291 is the critical care that is given, and it is, since it is given for 48 minutes, we will look for this code, and it has only 1 unit of 99291. So here we finished with the critical care. I hope the presentation was helpful to clear all your doubts, and then we will have the next CNM where we will finish with the nursing facility, prolonged service time, and then the preventive care.